Jamaica will soon benefit from advanced treatment for stroke. A mechanical thrombectomy therapy workshop is now ongoing, which will see stroke patients living longer. Shamela Pullen tells us more in the health report.
A stroke happens when blood flow to a part of your brain is cut off. Without the oxygen in blood, brain cells start dying within minutes. In Jamaica, this is one of the leading causes of death and the second leading cause of death worldwide.
In 2018, stroke accounted for 13.6% of stroke deaths in Jamaica. When you look at the age-adjusted mortality rate for stroke in Jamaica versus other countries, we are twice as high as the US stroke mortality rate. Jamaica ranks 100th in the world.
So at the recently concluded Caribbean Neurosciences Symposium in St. Andrew, medical experts agree that this area demands attention and improvement. They're exploring several treatment options, including mechanical thrombectomy therapy, which is considered highly effective. It involves removing clots from the brain and restore function.
When we use this very powerful therapy, almost a half of the patients will go home and have a very good outcome. In addition, mechanical thrombectomy has a mortality benefit. This is life-saving therapy. So in patients who do not have mechanical thrombectomy and they're experiencing this type of stroke, a third will die. And that number is lower when we do this effective therapy.
Neurologist at the University Hospital of the West Indies, Dr. Tamika March, points to studies showing that approximately 40% of patients who have suffered from a stroke have moderate impairment and will require special treatment, while 20% of patients become totally dependent and they would need a nurse to care for them.
Our vision is to have clotbuster therapy, thrombolytics, and clot removal procedure, thrombectomy, as part of our management of stroke at UHWI. A retrospective study over the 5-year period done at UHWI reveals 20.6% of our patients had large artery atherosclerosis stroke subtype, which is indeed significant, hence the need for thrombectomy.
However, there is limited access to this therapy because there aren't enough trained operators and centers in Jamaica and the Caribbean. To this end, the University Hospital of the West Indies has started training in this area to advance stroke care in Jamaica. The doctors say the service will be available soon. With your health report, I'm Shamela Pullen wishing you good health.